So we are going to learn about congestive heart failure. So the main function of heart is to pump oxygenated blood to different organs in our body. So from aorta, what happened? It goes to legs, stomach, brain, different organs. Huh? So this is the main function of heart. If it doesn't work, then we call it as heart failure. We call it as heart failure. So this heart failure, uh, we 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 learn by 1 second. Okay, so we try to find this heart ejection. It is called as ejection fraction. The amount of blood comes out from our heart on each beat is known as ejection fraction. We do by an instrument called 2D echo. Echo, there are different types. Now, this 2D echo is the simple method which determines the amount of blood ejected on one beat. That is called as ejection fraction. So this ejection fraction should not go below 40%. Below 40%. If it goes below 40%, then you are considered that we have heart failure. So what happens is that, so I told you that heart is an organ which pumps blood, oxygenated, deoxygenated. It pumps oxygenated blood to different organs and it pumps deoxygenated blood to lungs. So what happens is this, the circulation is very good when it is working properly. If it doesn't work, what happens? Blood starts accumulating. Then there is a congestion. Then that's why we call it as congestive heart failure or congestive cardiac failure. So heart failure, you can tell in simple terms, or we can also call it as, in the medical term, it is called as congestive heart failure or congestive cardiac failure. So what is the main reason? We learned. So what happens is that heart doesn't pump blood to different organs. So there is congestion of blood. Blood starts accumulating. Just like if the flush doesn't work in our washroom, if a pipe has blocked, then even if you flush, what happens? The water starts accumulating in the toilet. In the same way, if heart doesn't work, the blood supply to different organs will stop. At the same time, blood starts accumulating. That's why we call it as congestive cardiac failure or congestive heart failure. Congestive heart failure. So this is the terminology. And what about this ejection fraction? It is determined by 2D echo. 2D echo. Echo is an instrument. With the help of sound, they will determine the amount of blood coming out from each ejection. Then it is called as ejection fraction. This should not go below 40%. If it goes below 40%, heart is not pumping properly. So these are some of the ranges. So high ejection fraction, this will be more good for athletes. The one who runs very well, the ejection fraction will be very, very good. Normal function is between 55 to 70%. This should be for a normal person. Low fraction is 40 to 55. You are there is the stages, stage 1, stage 2, stage 3, stage 4 heart failures. So depending on that, they give for us and they give this. So in these conditions, so we have learned all this. You can see it here. So that's what we learned here. See, congestive heart failure is a condition in which heart fails to pump oxygenated blood to distant organs. Why we need this? To do our physiological work daily, we need oxygenated blood. To get energy, to produce ATP, we need oxygen. So this we do it. And why it happens? You see, here is the structure. There may be some structural problem. That means myocardium of heart may not be so powerful to contract. Myocardium, we will not have the strength. It may become weak. Then functional disorder, heart rate is also one of the problems. So these are the two reasons. Because of that, ventricles will not fill properly and will not eject properly. So because of this, you see, congestive heart failure is accompanied by abnormal increase in blood volume. So there is increase in blood volume in the heart itself, lungs, arteries, veins and capillaries, arterioles and all those things, veins, venules and capillaries. When fluid starts accumulating in capillaries, we know that capillary is a single epithelial layer cell. So fluid will start accumulating from, will start flowing out from the capillaries, and we get edema in the peripheral system. All our extremities, especially legs, there is like elephantiasis, like it becomes. In the lungs, fluid also starts accumulating and cause difficulty in breathing. That's why I think we have placed in this, you see, in this diagram, you can see it. Sorry. See, abdominal swelling, because your abdomen will be like a pregnant woman like. So swelling will be there. What happens? Lungs will start accumulating here. Fluid will be starting. So fluid will accumulate here. Difficulty in breathing. So you, even for the small walk, I used to tell you in the class, what is the difference between heart failure and a heart attack? So if you walk for maximum 10 steps, you get difficulty in breathing, not pain. If you get pain, it is heart attack. Heart attack or angina pectoris. If you get pain, it is angina pectoris. If you get difficulty in breathing, you consider 2 steps, climbing the steps, 2, then also you get pain, you get difficulty in breathing. Getting up from the bed and going to washroom itself make you, the patient, to feel difficulty in breathing. If it is a difficulty in breathing, it is nothing but congestive heart failure, or simply you can tell heart failure. So all the legs, extremities of legs will be swelling. That's what I was telling. Just like your leg will become like elephantiasis. Will become like elephantiasis. It swell. So from this, you can predict what are the drugs to be given. So one is to increase heart function. You need something. Then one diuretic drugs also we need to give. So it can expel the fluid which is collected. So let us see what happens. So here is the ejection fraction. Ejection fraction, I told you that it should not go below 40%. If it is below 40%, we call it as congestive heart failure. So because of this heart failure, body will start producing compensatory mechanisms. So compensatory mechanism. So in heart failure, what happens? Heart is not pumping properly. So the important thing is cardiac output is decreased. When cardiac output is decreased, you can see there is increased sympathetic nervous system. You know what happens to our body when there is increased sympathetic nervous system? Adrenaline, noradrenaline, dopamine will be released and increases heart rate. Here you see the cardiac output was decreased, now increase heart rate, and cardiac output will also increase, and it also causes vasoconstriction. Vasoconstriction. So what happens? The fluid will start circulating again. One more important thing, we told that for one of the important organ during this process is kidney. Renin-angiotensinogen mechanism. Angiotensin-angiotensinogen mechanism we learned. So kidneys will receive less blood. So in response to that, renin is released. Renin is released. Then we learned in hypertension chapter what happens. Say angiotensin 2 is produced. I'm not replacing angiotensin 1, angiotensin 2, all those we discussed. So increased angiotensin 2. So when this happens, we also learn increased blood volume. Actually, see here, listen, increased blood volume, increased preload and afterload. So blood starts accumulating in the arterioles and veins. Then it is called as preload and afterload. Then what happens is that because of this, the chamber of heart, our heart size is fist. My heart size is of this fist size. Now what happens? Because of this, the heart size is increased. This is called as myocardial enlargement or myocardial hypertrophy. This is good for some time because heart can pump little, but over a period of time, it worsens the disease. We think this is compensatory mechanism, but the activation of renin will worsen the disease again. Sometimes we try to help our friend, but it becomes bad. In the same way, the renin-angiotensin in this disease condition, it worsens the patient condition because there is increased blood volume. Already body is full of blood, fluid. I mean, the blood means here fluid. That's why all the extremities are all in swelling. But because of compensatory mechanism, still worsens the disease. That's why we use some of the drugs, ARBs, AC inhibitors. We studied, no? Are you getting on it, please? So first, from the first slide, I told we can get that myocardium function may be not working properly. The strength of myocardium may be very less. So we can give drugs which increase the strength of heart. That we can do. Now we can see beta blockers can be used. We will tell the beta blockers, specifically 3 drugs are used, especially in CHF. And also we can see renin blockers we can use, EC inhibitors, ARBs can be used. So these are some of the compensatory mechanisms. And also, so there is release of anti-diuretic hormone. So kidney will think that there is no urine formation, so it produces anti-diuretic. Urine will be stopped. That also nonsense. So diuretic drugs can be given. So these are some of the drugs which we can give it. Let us learn what are the causes. Hypertension, heart failure may be reason. Hypertension, vascular heart diseases, blood vessels not working properly, then dilated cardiomyopathy, enlarged. For sports persons, no, when they run, for example, some of the people they'll run for marathons. Their heart size is very big. Their ejection fraction will be nearly about 60-70% like that. Over a period of time, they also get heart failure. And then hypertrophic cardiomyopathy, increased size, then vascular heart diseases, coronary artery diseases. Coronary artery diseases, these are the some of the causes. And you can see the symptoms: pulmonary congestion. So in the lungs, water will start accumulating with the left ventricle failure. Sometimes what happens, no, entire ventricle may not get failed. Only one part. If it is a left part is failed, then we get accumulation of fluid in lungs. If it is right side, we get edema, especially here. You get some edema here. Then dyspnea, orthopnea, fatigue, frequent urination, renal impairment, arrhythmias, ischemia. These are some of the symptoms which are with congestive heart failure patients. Any doubt, please? Okay. Now, what are the drugs used in treatment? What are the drugs used in treatment? We learned that drugs, little idea I have given, you can see it here. Positive inotropic drugs. I told you what ino means. Ions means calcium. You remember like calcium here. Calcium is very important here. So calcium, drugs which increase calcium are to be given. You can see here there is no calcium channel blockers. We don't use calcium channel blockers here. They're contraindicated. Please remember. So one of the important drugs is number 1, positive inotropic drugs. Positive inotropic drugs, drugs which increase contraction. So the one of the important ion responsible for contraction of ions is calcium. So that is what are the drugs? You say cardiac glycosides, beta adrenergic agonists, then phosphodiesterase inhibitors. All these are positive inotropic drugs. Then one more drugs, the patient, please remember, patient will not be given one dose, one drug. He will be given multiple because the defects are multiple. Multiple. So diuretics they give, AC inhibitors, then ARBs, especially valsartan. Especially valsartan is included here. Then beta receptor blockers. So here we told agonist. Here we told agonist. Here we are telling beta blockers. We will learn why. Beta blockers. One more new drug is neprilysin inhibitor. It is called as Sacubitril. This is the one of the good drug nowadays they are prescribing in combination with valsartan and Sacubitril. In this combination, these two, valsartan plus Sacubitril combination, they're prescribing for congestive heart failure patients. It is called ARB plus neprilysin inhibitors. We will study. So these are some of the drugs which are used in treatment of congestive heart failure. So you might have studied some information about cardiac glycosides in pharmacognosy. Then we studied about adrenergic agonists. I think from a video you have learned So what happens here? Adrenaline, noradrenaline, dobutamine, especially dobutamine, they are given. So they increase force of contraction. Then phosphodiesterase inhibitors, diuretics. You can give some of the drugs to given are diuretics, then ARBs, AC inhibitors, beta receptor blockers. 3 drugs are there. I will tell you that. Then one more combination of drug, which is one more drug, neprilysin inhibitor. It is usually combined with valsartan. So these are the drugs used in congestive heart failure. First, we will learn about cardiac glycosides. It is important drug. Nowadays, they're not giving these drugs because of valsartan, sacubitril, metoprolol, carvedilol, the 2 drugs. They're better drugs. And one more is that this you need to have hospital setup. These drugs to be given is hot hospital setup, and they have narrow therapeutic index. Even small change in dose levels, it causes very dangerous effects for us. That's why it is narrow therapeutic effect is present with cardiac glycosides. But anyhow, we will start with cardiac glycosides, then we go for beta agonists, then we go for next, we learn for phosphodiesterase, then diuretics, not all those, 1-2 drugs we will study, then ARBs, then sacubitril, then last beta blockers we study. So up to here, any doubt, please? Are you listening?
Yes.
Karishma?
Yes, sir.
Okay. Any doubt? Okay.
No, sir.
Thank you, Khalid. Okay, let us see next. So cardiac glycosides. This is even in pharmacognosy, you will learn. You can see it. Cardiac glycosides. Here we mainly concentrate on chemistry part and mechanism of action, and we also learn from where they get. Yeah? So cardiac glycosides are called as cardiotonics. Cardiotonics. Tonics means what? So whenever you are weak, when you go to doctor will prescribe you tonic. Tonics means drugs which increase strength. When you are physically weak, they give tonics, maybe vitamins, some B complex vitamins, some minerals they give. In the same way here, these drugs are tonics. Where? For cardiac. So these are cardiotonic drugs. So why they are called, you see, they are called as cardiotonics because they increase the strength of cardiac muscle, especially myocardium. So what happens is that contraction. So for every contraction, previously it was like just like this, and now it will do. So what happens? Fluid will go out from the ventricles. So from here, once it starts pumping like this, so whatever it is present, the blood is present in the ventricles will start moving. Circulation will occur. So this is the cardiac glycosides. So that's why they called as cardiotonics, which increase the strength of cardiac muscle. Now, these cardiac glycosides consist of 2 parts. 2 parts. One is aglycone. Any glycoside, I think you people learned. We are not going much into that. Aglycone, which is responsible, aglycone or genin. Aglycone, cardiac glycosides will be having sugar. This is called as a sugar portion. and non-sugar portion. So the non-sugar portion is called as aglycone or genin. So this portion is responsible for cardiotonic effect. What is this portion? It is a steroidal nucleus, and a lactone ring is present, and a lactone. This is called as aglycone portion, and this portion, this is called as sugar portion, which is called as glycone, This is called as glycone. So the main function of glycone or sugar portion is to carry aglycone, This is aglycone to the site of action. So when you give this drug, now what happens? This sugar molecule will help in lipophilicity, in maintaining the lipophilicity. We know that, you see, these are the structure, you see. There is all carbon compounds. So what happens? It is more lipid soluble in nature. Now it is combined with sugar or water soluble. So appropriate partition coefficient we get. We studied in 3404 partition coefficient and all those. We apply here. So these sugars, see, we have given N. So the sugars will be usually 3 to 4 sugar molecules are attached. We will learn that. So the cardiac glycosides or any glycosides have two portions, aglycone or glycone. Aglycone, and one more is glycone. Aglycone is also called as genin, which is responsible for biological activity. You can see these are cardiac glycosides. There are anthraquinone glycosides. So here, anthraquinone glycosides, what they do? They help in treating constipation. Here, these drugs help in increasing the heart function. So this is what is aglycone portion here? The steroidal nucleus and lactone moiety. Remember that it is lactone moiety. So this is next. So these are the biological sources. This is from the plant, Digitalis lanata. Lanata means white flowers. So they have white flowers in it. Whereas Digitalis purpurea. Purpurea means they have purple or pink color flowers. Purple color flowers. There are two sources. Many sources are there. We can study next. These are primary important ones. Digitalis lanata. What is this? The plant which has white flowers. These are called as lanata, cardiac glycosides. What are the main important chemical constituents? Is from Digitalis lanata. Please remember, from Digitalis lanata, the important glycoside is digoxin. Digoxin is more, what's that? One of the most prominent glycoside we get. It other glycosides also, you see, digitoxin and G-toxin. You also get another glycosides. Clear? Digitalis purpurea, it has two chemical constants. You see, that is digitoxin, which is the primary chemical constant. That means more is produced by purpurea, that is toxin, digitoxin. Whereas Digitalis lanata will produce digoxin. It also produces digitoxin, but minor quantity. quantity. Whereas digitalis purpurea, purpurea produces the most important chemical constant. More chemical constant is digitoxin. And another one is gitoxin. Only 2 are produced, whereas here 3, and purpurea will produce 2. 2. Both of these plants belong to family Scophleraceae. Scophleraceae. All these are cardiac glycosides. Now, some more cardiac glycosides are these. You can remember other cardiac glycoside is Strophanthus gratus. Strophanthus gratus, which will produce the chemical constant Voubinen. Strophanthus gratus, then Strophanthidine, Strophanthidine from Strophanthus cumbi. These are like digitalis lanata, like this. Then Voubinen, this is Strophanthus gratus. Then squill, this is the plant called as squill, which produces procillaridine. These are also cardiac glycoside, but less prominent from those cardiac glycoside. Digitalis lanata, digitalis purpurea. Lanata is white, purpurea, from the name you can see purpurea, purple color. These are less prominent, but once they were good drugs. If you take in more, they are very toxic. If you take in high dose, they are very toxic. Once many people, they used to use these extracts to kill others. So these are the examples we will study about cardiac glycosides. Now, here you can see the chemistry of cardiac glycosides. So now, based upon the aglycone portion, cardiac glycosides are divided into 2 types. They are divided into 2 types. So what are that you see? So here you see this is cyclopentanoperhydrophenanthrin ring. We studied this during estradiol and all those things. Cyclopentano. So here you see it has steroidal nucleus, which is cyclo. Cyclo means cyclic ring. Pentano, 5. So about this D ring, it is all this one. Cyclopentano. What is this ring size? 5-membered. Phenanthrin. Phenanthrin ring means A, B, C ring is called as phenanthrin. It is called as phenanthrin. A, B, C ring. It is called as phenanthrin. Now, at each carbon atom, there is no double bond. There is extra hydrogen. So that's why we call it as perhydro. So this ring is called as CPP. You can also call it as, in short, CPP ring. It is present in all our steroidal drugs. The steroids which are produced from us, estrogens, progesterone, testosterone, all these will be having this CPP ring. What is this ring? So this ring is called as cyclopentanoperhydrophenanthrin ring. So first cyclopentano is the regarding D ring. It is the regarding D ring. Perhydro means at each carbon atom there is extra hydrogen. That means entire molecule. Phenanthrin means ABC ring. This is a phenanthrin ring. Then numbering starts from A ring. We know that I told you many times, naphthalene numbering. Numbering should be from the first unfused carbon atom. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You should start from first unfused ring, then move to the, you should complete first to the ring. It should not go from here to this end. What is that? By clockwise direction, it should not go. Why? Because we need to give numbering to the first, the ring which we selected. Many people in our exam also written wrong. So this is how we should do. Then after this 10, again, second ring. Third ring, B, we are going. This is the first unfused here. So 11, 12, 13, 14. See, this ring is completed. Then from 14 to 15, 16, 17. Then here you see 18, and this is this is 19. You see, these are the 19. Now, based on the 17th lactone ring, at 17th position, there are lactone. What do you mean by lactone? Cyclic esters. Lactone means, see, these are lactone rings. What is lactone? Cyclic esters. Cyclic esters are known as lactones. Cyclic esters are known as lactone. If it has 5-membered lactone ring, then they are called as cardinolides. These are obtained from plants. If they have 6-membered lactone ring, then they are called as bufordinolides. Bufordinolides. 6-membered lactone rings are called as bufordinolides. Where do you get? These are especially obtained from the toad frog. That is male frog. Male frog skin is also very toxic. Some of the frogs are very toxic. So that toxic is used as our drug. We give in low concentrations. So here, what we learned. So here, these are the number 17 based upon 17 ring. 17 ring, we divided the drugs as 2 types. We divided the drugs as 2 types. The one which has 5-membered lactone structure, I told what do you mean by lactone? Cyclic ester. Cyclic ester. So this 5-membered lactone, if it is there, then we call it as cardinolides. All these are cardiac glycosides. Cardinolides means they are obtained from the plants and having 5-membered lactone ring structure. If it has 6-membered lactone structure, then it is called as bufordinolides, which are obtained from animals, that is toad frog. Toad frog. You can see it here. Here you can see it. 1 second. So this is like furon. It is like furon. This is furon. That's why cardinolides have furanose lactone ring. You can also call it as furanose. Sugars. These are like sugars. Furanose. And another one, bufordinolides, is pyranose lactone. Pyrone lactone string. So this is pyrone, like pyridine. So these are the about the structure of cardiac glycosides. Any clarification here? You must be having some doubts here. You can ask here. The floor is open. Please unmute yourself and ask the question. Hey. Clear, please? Let me ask some questions. Brian. Yeah. Yes, please. You can ask. Unmute yourself and ask. Yeah.
Excuse me, sir.
Yes.
Sir, you said we should finish completing like numbering one of the ring first before going to the other. But if you see A and B, you stop numbering at 5, then like the numbering wasn't complete at A, you went to B.
No, 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 no. Here
Mhm.
we will. I told you many times. These are the junctional carbons. What happens? No, when you start numbering from the first unfused carbon atom, you should finish your ring, and then you should come to the fused ring system. You should come to this place. You should start numbering from here. You can't go again here because this fused carbon atom should get highest numbering. We told this even in what is that, antipsychotics and all those things, and antipsychotic drugs. So what happens is that you should start from first unfused. So first you identify the fused or unfused. So first there are two fused rings, fused carbon atoms here. Identify. Then first unfused you should. So what happens once you start here? You should complete your ring. Then one more important point is that this unfused carbon, this fused carbon should get the highest numbering. Highest numbering. So you should, after this, you should move to the B ring, then come back again where you started. It should come like that. So this type of numbering, it is like a snake. See, like a snake, it is moving. So it is like a snake, it is moving. So this is called as a serpentine way of numbering. In a numbering, in IUPAC system, this is one type of way of numbering. You see, this is one type of way of numbering, like snake. It is moving like a snake. We will learn exclusively in a steroid chapter next semester. Serpentine way of numbering. Any doubt, please? Okay. Please sign for attendance. Now, we studied in this slide, we studied about aglycone portion. See what we studied? We told cardiac glycosides. It consists of two portions, aglycone and glycone. Glycone is sugar portion, aglycone is non-sugar portion. There are some of the cardiac glycosides are digitalis lenata, digitalis purpurea, Still, Strophanthus gratus, Cumbi, like this. Then we are going to study about cardiac glycosides. So about cardiac glycosides, we started studying about aglycone portion, that is ABCD ring, which is called as cyclopentanoperhydrophenanthrin ring, based on the functional group 17. The functional group 7 at 17 position, based on the lactone size, we are dividing into two types. That is cardinolites, which are obtained from the plant having 5-membered lactone ring structure. buffer or bufordinolides, which has 6-membered lactone structure. What do you mean by lactone? Also, I told you lactone means cyclic ester. So when you break it, know what happens? You get a when you break this, you get your carboxylic group, you get your carboxylic group and hydroxyl group. That's why they are called as cyclic esters. Lactone. See, this is one. Okay. In beta-lactam antibiotics, it is lactam. Cyclic amide will be present. Instead of nitrogen, there is instead of oxygen, there is nitrogen. Then it is called as lactone. That's it is called as lactam. Sorry. LA, hey. It is called as lactam. 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 When there is nitrogen here. If there is oxygen, it is called as lactone. It is called as lactone. So these are the things. Next one, we will discuss about the sugars present in it. The sugars are present usually 3 to 4 sugar molecules will be presented. 3 to 4 sugar molecules. Let me show you next slide. So these are the sugar molecules which are present here. You see, the sugar molecules are present 3. For example, in purpurea glycoside A, this is glycosides. It has sugar 3 digitoxose and 1 glucose. So that's why we are telling that we are telling, you see, glycosides usually contains 3 to 4 sugars. Where the sugars are attached? At the third carbon atom. At the third carbon atoms. Here we know numbering. You see 1, 2. This is third. At the third carbon, the sugars are attached. In what configuration? Beta configuration. We also learned usually these rings are flat. When there is a thick line, when the functional group is in thick line and the flat structure, this is beta. When the functional group is in what is the dotted lines, this is called as alpha configuration. So the sugars are attached to the cardiac aglycone portion by 3 beta configuration. 3 beta configuration or 3 hydroxyl group. So aglycone portion will be having OH group. So the most common sugars, you see what we told, 3 to 4 sugars. What is the most common sugar is digitoxose. Digitoxose is the main sugar. It is not present in any of the drugs or any of in the nature. You see, it is this is the only plant which has this digitoxose. D-glucose, D-rehymnose. These are the prominent sugar molecules present in the cardiac glycosides. Now, I told you that the sugar molecules are attached at the third position of aglycone portion. Now, between the sugar molecules, how they will be present? They also will be in beta configuration by 1,4 linkage. You see, if this is 1, second, and this is 4, here fourth. Now, fourth one of one sugar molecule will attach to the first one of the other sugar molecule. First one of the other sugar molecule. So it is called as 1,4 linkage. 1,4 linkage between the sugar molecule. Again, here you see this is number 1, this is number 2, this is number 3, this is number 4. Now here it will be attaching to another sugar molecule. So this is how the sugar molecules are attached. So At the first sugar is attached to aglycone by 3 beta configuration via hydroxyl group, and between the sugar molecules it is 1,4 linkase beta configuration. What are that sugars? You see, digitoxose, rhabnose, and glucose. I told you that these cardiac glycosides have digitoxose, the sugar, which is unique. So the important test used for identification of this digitoxose is Killer-Kiliani. This is the Killer-Kiliani test. This test will identify the presence of digitoxose. This sugar is only present in cardiac glycosides. So you take a plant, and if it is responding to this Killer-Kiliani test, then you can tell these are having cardiac glycosides. Cardiac glycosides. This is a digitoxose. Killer-Kiliani test is used to detect digitoxose. It is used to detect digitoxose. Now, so now what are the, see, we told that it has two types of glycosides. You see, we told that we will study these two exclusively. So digitalis lanata, digitalis purpurea. Now let us see what are those are. Now see the chemical constituents of purpurea glycosides and their metabolism. See, these purpurea glycosides, purpurea glycosides, they sorry, wait. See, they have glycosides in the nature, in the plant. How they look like is like purpurea glycoside A. Purpurea glycoside in the plant, they look like this one. One more is purpurea glycoside B. These are called as primary glycosides. Primary glycosides. Purpurea glycoside A and purpurea glycoside B on enzymatic hydrolysis. By enzymatic hydrolysis in the body of plant itself, it can convert on. What is the enzyme here? Disypuridase. What is the enzyme? It is the I told you enzymatic hydrolysis. What is that enzyme? Is disypuridase. What happens? The primary glycoside is converted to secondary glycoside. That is, you see, you get digitoxin plus glucose. See, in previous slide, I told you that it has aglycone portion. At third position, there will be 3 to 4 sugar molecules. So these are the 4 sugar molecules. You see, in purpurea glycoside A, there is digitoxose. How many molecules? 3 molecules of digitoxose we have, followed by glucose. So when you have all this portion, then it is called as purpurea glycoside A. It is called as purpurea glycoside A, which is primary glycoside. By enzymatic hydrolysis, what happens? This glucose portion will go. Then up to here, that means this entire portion and plus digitoxose, it is called as digitoxin. So on digitoxin, on acid hydrolysis, you get aglycone portion, which is called as digitoxygenin. Aglycone portion is also called as, say, in this slide. See here, aglycone portion is also called as genin. It is also called as genin. That's why the name of this aglycone portion is becoming digitoxygenin. So which on acid hydrolysis you get digitoxygenin and digitoxose. Digitoxygenin and digitoxose. In our clinical practice, the drugs are available as secondary glycoside, that is digitoxin. In clinical practice, drugs are not given in primary glycoside. Why? Because primary glycosides are not absorbed properly. They cannot break. We don't have this enzyme digipyridase. Digipyridase is present in only plants. That's why in our when you want to give this cardiac glycoside to patient, you will be having as digitoxin. That's what you see. The primary glycosides are less absorbed, less stable than secondary glycosides. That's why we give in the form of digitoxin. So in our body, we have acid. So it will hydrolyze and give digitoxygenin. Digitoxygenin means this portion which goes to heart and increase contraction of heart muscle. So this is the glycosides. So you can see it, the important glycoside in the main glycoside, a purpura glycoside A, which produces action is digitoxygenin. Digitoxygenin has two hydroxyl groups, that is at third position and at the 14th position. It is called as digitoxygenin. Whereas purpura glycoside B, see, purpura glycoside B on enzymatic hydrolysis, it removes glucose. Then it is called as digitoxygenin. Here it is digitoxin. Here it is gitoxin. So the first di, you remove di, it becomes gitoxin. For gitoxin, it has three hydroxyl groups. That is C3, C14, and extra, that is 16. 16. Now you can see it. This digitoxygenin is more lipophilic than this. So this drug will start accumulating in our body more compared to this. Why? Because of this extra hydroxyl group will cause excretion faster compared to this. This is all you need to learn about pharmacokinetic parameters. Clear, please? Any doubt? Okay. Now one more for digitalis lenata. For digitalis lenata, there are three glycosides. Here also you can see it here. So digitalis lenata, you see digoxin, digitoxin, gitoxin. Purpura, I told you only two. That's why purpura glycoside A, purpura glycoside B is present. See, you can see the last two. These two are present in both of these plants. Now, digitalis lenata has one more chemical constant is digoxin. Let us see what is the primary glycoside present in lenatoside. See, in lenatoside, please try to listen. Here, this is aglycone portion. We told that at third hydroxyl group, the sugars are linked. Now here you can see it. We learned that the sugars are 3 to 4 sugar molecules. 3 to 4 sugar molecules. Now the sugars which are attached at the third, attached at the third, you can see it. Sorry, which are attached at the third, you can see it. You see, at the third is 2 digitoxos, and one more sugar is acetyl digitoxos. So the sugar molecule, let me show you the sugar molecule, digitoxose. So this is digitoxose. You see, this is the third hydroxyl group is acetylated. Hydrogen is removed and you get acetyl group. You get acetylated. Then it is called as, that's why it is called as 3-acetyl digitoxose. 2 of them are simple sugars digitoxose, and the third one is 3-acetyl digitoxose. In purpurea glycoside A, they are simply digitoxose. They're simply digitoxose. Please listen. Try to concentrate. Here they are only simply digitoxose. Whereas this you can see it here. You can see it. It is 3 digitoxose, 3-acetyl digitoxose, and 2 digitoxose, followed by glucose. If it is acetylated, then it is called as lenetoside A. Now you can see it here. You see, lenetoside A on deacetylation. If you remove this. If you remove this group, it becomes digitoxose. That is 3 molecules. Then it is nothing but purpurea glycoside A. Lenetoside B on deacetylation. Here also, see, in all these molecules, the third digitoxose is acetylated. You can see it here also acetylated, here also acetylated, acetylated, here acetylated. Based on that, it is called as lenetoside A, lenetoside B, lenetoside C. Lenetoside A. Now, here you can see it on metabolism. On metabolism, you can see it on enzymatic hydrolysis, same way. This will go, then we call it as acetyl digoxin. If on acid hydrolysis, this also goes, we get digitoxygenine. So from the name itself, you see toxin. The drug is toxin. Whenever you have what is that? Toxin. It states the drug starts accumulating in our body slowly. If you take today drug, it will slowly start accumulate, just like heavy metals. The drug starts accumulating in our body. In the lenetoside B, it has three hydroxyl groups, that is C3, C14, and C16. 16. And you see, this is the lenetoside C, which is called as digoxygenine. Among all these, digoxygenine is very, very good drug. It has hydroxyl group at C3, C14, and C12. Previous was, you see, C3, C14 is common. In all this, you see, C3, C14, hydroxyl group is common. If it is 16, it is starts with the letter G, Gtoxy, G. You can consider 16 number 6 like this and G also like this. You can remember like that. I also used to remember like this. Then in the 12th carbon, if the 12th carbon has one more hydroxyl group, then it is called as deoxygenine. Deoxygenine. So 1 second. This entire one is called as primary glycoside. If this sugar molecule, if it goes, it is as secondary glycoside. Up to here, it is secondary glycoside. In the body, in the clinical practice, drugs are given as secondary glycosides. So in the body, what happens? These sugar molecules, as we learned in the second slide or third slide, the sugar molecules are very important to carry to the site of action. So in the body, what happens? After reaching cardiac muscle, it will break and you will release deoxygenin. Yes, Priska, please.
So I want to understand why the deoxygenin is better than the digitoxygenin, while the digitoxygenin is more lipophilic than the other one.
Because it has 2 hydroxyl group here, though it has 3. It has 3. Here also there is 3 hydroxyl groups, but this is a better profiles are present during clinical practice. That's why deoxygenin is widely used drug than gitoxygenin. So when you give, there are some type of studies. What happens? No real studies. When you give to patients, some during clinical trials, they see which drug is better observed, which is showing better profiles. That's why they're telling this deoxygenin is very, very good drug. They study double blindness, placebo study and all this. After doing these studies, they are telling this deoxygenin is good drug. That is digoxin. So that means, what do you mean by digoxin? Even this acetyl group is removed. The drug is present like this. Digoxin means what? Deoxygenin plus 3 molecules of digitoxos will be presented. Will be present. Anything, please? Okay. Now let us see its mechanism of action. Let us see what is its mechanism of action. So these drugs will block sodium potassium ATPase pump, which is mainly present in cardiac muscle. The sugar molecules will help to carry the drug specifically only to the heart. It will not go to another organs. That is the beauty of these drugs. I don't know how it goes, but the cardiac glycosides are specifically observed. That is the God engineering work. So they enter cardiac muscle and block sodium ATPase pump. You know about this pump, no? Vital pump. This pump is vital for our life survival. This pump, the sodium ATPase pump, is very important for life survival. So what it does, it sends out sodium from our body, from our cell, and make potassium to go inside. Sodium will go out. 3 sodium molecules will go out of cell, efflux, and 2 potassium ions will come inside. So this is the normal function, and this pump works with the help of ATP. with the help of ATP. Only in presence of ATP, this pump will work. When this pump is blocked, what happens? Sodium will not go outside the cell. So there is increased sodium ion concentration. As soon as you block this, there is increased sodium ion concentration. So body tries to send out the sodium by any means. Dangerous, because sodium needs some 2 to 3 milli, it should be present, but not more. So what happens is that when sodium concentration is more, there is activation of another pump called as sodium calcium pump. Sodium calcium pump. So this is not working with any enzyme, any protein, any ATP molecule. Here it was working with this in presence of ATPase. Now it is based upon the concentration, it will work. So this pump will activate as soon as when the sodium concentration in the cell is increased. Now what it does, you see, it sends out calcium. Efflux means sending, and it sends out sodium. Sorry, I think I told calcium. It sends out sodium and allows calcium to enter. So what happens? Let me take one different color. So this is happened. So the inside the cell, the sodium concentration has increased now. Now what it does? It will send sodium out and calcium inside, not potassium levels, you see, it is calcium. Once calcium enters into the cell, what happens? We know it acts on actin-myosin filament and increase the contraction. Increase the force of contraction. When increase force of contraction, what happens? The fluid which was accumulated in the ventricle will start ejecting. So when you remove in your bathroom the blockage, what happens? Fluid will go very fast. In the same way, what happens? Heart, complete emptying will occur. So all the organs, distant organs, the blood supply is restored. So this is how it acts. It acts. You can see in this is also one more diagrammatic representation. You can see it here. So this is the sodium ATPase pump. What happens? Sodium entering. Sorry. Right. Potassium entering. Sodium is sending out. Now when it blocks, what happens? The sodium concentration is increased. So what it does? The sodium is going out and calcium is coming inside. This doesn't require any ATP or any enzyme. It all depends upon the concentration levels. Now the calcium levels are increased, then it acts on actin-myosin filament and increase force of contraction. This is the mechanism. So now in response to this, what happens? You can see it. Here, you see, this is also very important. You see, at the same time, after doing this, starting of blood and blood coming out from the ventricle and all this, at the same time, the duration of systole is decreased. Systole means contraction period. So the duration of systole is shortened, allowing greater time for diastole. Your heart needs some rest. So 0.8 second is our cardiac cycle. 0.8 second is our cardiac cycle. Now more time, that for maybe 0.5 seconds. Here it may be 0.3 seconds. You give rest to your heart. So more greater time for diastole. So don't think that heart doesn't take rest. It takes rest. During rest only, blood starts filling it. From both the atria and also ventricle. In the atria, from supraventricle and superior vena cava, what happens? Blood starts filling in atria and atrias. Then again, ventricle also it fills in. So more blood is filled during the more time is given during the diastolic, and ventricles. So what happens is at the same time the duration of systole is shortened and allowing greater time for diastole. Both ventricles are filled and heart is at rest now. It's very good. In congestive heart failure, what happens? No, heart will think that I'm not doing more, and it starts working more. So some of the students when they fail in exam, they stress themselves, they try to work out, but it will not get positive results. In the same way here also, more heart will work on. Now what happens? Heart takes some more time. At the same time, you see, the diastolic size of heart is reduced. In the previous, we told during compensatory mechanism, heart size is enlarged, we told. Heart size is enlarged. It will become little like this. Now, because of this, it becomes too normal. I can't tell normal. The size is little smaller than compared to patient. So oxygen demand for that heart muscle will be less. Will be lessened. So this is the thing. So this is also one more advantage. Diastolic size of heart is reduced. So oxygen required is also reduced. So digitalis work with less energy. So what happens is that your heart size is decreased. So oxygen demand also decreased. At the same time, it is efficiently working. So with one shot, two works, it is happening. So these are very good drugs. So this is so what happened? Your heart will start working with less oxygen utilization. So this is the complete mechanism of action. You see what we told? The first thing is that it blocks the sodium ATP. Then there is increased of sodium levels, calcium influx, the increase actin myosin filament, inotropic effect. Because of this inotropic effect, it decreased the size of heart and also increase the heart resting time, that is diastolic time. When the heart size is decreased, what happens? Oxygen consumption also decreases. It also decreases. So with less energy, it works effectively. It works effectively. So what are the uses of these drugs? You see, we can use in treatment of heart failure. How it works? Inotropic effect. It increase ejection fraction. So the patient which may be less than 40, now it may go to 45. I have seen some of patients with 30, 35, living 10 years. Living with 10 years. I have seen some of the patient with 45 going in 6 months. It's all depends person to person. And I have seen some patients, ejection fraction is 30, but they have spent their life another 10 years extra after getting congestive heart failure. So that is the ejection fraction. It can be improved. Then preload. It also decreased preload. Previously, it was increased. You see that compensatory mechanism. So decrease pulmonary congestion. And one more important thing, no, doctor will suggest them not to take more than 1 liter per day. So the heart patient, congestive heart failure is one of the most prominent disease for the death of cardiovascular, for the serious issues. So when you get this, no, what happened? They ask the patient to take not more than 1 liter. That is the reason, because if you take more, you are giving more pressure on your heart. Already it is failed. Suppose a failed student, if you take 5 or 6, some 10 courses extra, what happened? The same way here. And one more important use, you see, it's also used in arrhythmiasis. This is very peculiar, you see. When you don't have disease, when you take these cardiac glycosides, you get arrhythmiasis. You get arrhythmiasis. When you have arrhythmiasis, the drug treats this. How it treats, you see, it decreases AV nodal conduction. From SA node to AV node, the heart rate is decreased. That's what I was telling in previous slide. The diastolic heart rate also reduced. Then ventricle rate also is reduced in the atrial flutter and fibrillation. So these are the uses of these drugs. The side effects, you can see it. Arrhythmiasis, just now I told you that. Irregular heart rate will be obtained. Then severe hypokalemia. You can see it here. Potassium is not entering into our body. Clear? So there is a loss of potassium. When you take this, what happens? Potassium levels will be decreased. This is very dangerous. The potassium levels are very important to monitor. So one more important thing is that these patients, so every 1 week, already patient is in dying condition, they come and take the blood samples to check the sodium and potassium level concentrations. So this is an GAT, anorexia. You don't get appetite, abdominal pain, diarrhea you get. Then CNS, you see visual disturbances, blurred vision, color defects, vertigo, tingling, numbness in the lips, tip, nose, cheeks, and ears. You get numbness, skin rashes, eosinophilia, and gynecomastia. One more important thing, digitalis is also having diuretic effect. One more added advantage, digitalis not only increases heart function, it is also having weak diuretic, not a prominent one, weak diuretic effect. That's also good in the patient. So one of the most important thing is that these drugs will produce hypokalemia. There are some drugs, diuretics, which also causes potassium loss. So you should not combine the drugs with thiazide drugs. Thiazide drugs, chlorothiazide, hydrochlorothiazide, you should not combine with digitalis, because both of them will produce hypokalemia. So what is the best drug to use with the digitalis is potassium sparing diuretics. potassium sparing diuretics. So these sparing diuretics are there. What happens? They increase urine output by preserving potassium. So that's why they are very dangerous. I think up to here it's enough. Next we can continue. Any doubt, please? There are 50 students, but only 30 students have signed for attendance. Please sign for your attendance. Any doubt you can ask? Please sign. Any doubt you can ask. Next, we will meet on Thursday and we'll finish this chapter. We finished almost. Okay. If you're not having any doubt, let us leave. Bye-bye.